Bwrdd, good morning everybody and welcome to the annual general meeting of Powys Teaching Health Board for the financial year April 2025 to March 2026. My name is Helen Bushell and I'm the Director of Corporate Governance for the Health Board. Before we begin, I'd like to provide a brief technical introduction. Today we are using Microsoft Town Hall as our software to be able to deliver our AGM and allow you as colleagues and members of the public to be able to see and contribute. This offers you the opportunity to see live subtitles of today's proceedings. You should see a button in your settings to switch on subtitles. Subtitles for today's meeting are available in Gymraeg and English, as well as a number of other languages you can choose from. Please note that these subtitles are generated automatically from spoken English. Sections of the presentation given in Welsh will not produce correct subtitles, but the speaker will use both Welsh and English to ensure that nobody is excluded. Microsoft Teams also allows you the opportunity to raise questions. On your screen, you should see a tab with a question mark on it towards the top. This will normally be in the top right of your screen. If you click on this, it gives you the opportunity to ask questions. Please do ask those questions. We very much welcome them, and we will do our best to get to as many as we can today. If we do run out of time, though, we will make sure that we publish the answers to any remaining questions onto our website. On our website, you'll also find information about today's meeting, our annual report, and other information about the Health Board's plans and priorities. Today's meeting is also being recorded, but don't worry, this does not share information about you in the audience. Just the information you see broadcast on the screen today will be visible. That means that people who are not able to join us this morning will still be able to watch today's AGM at a later date. Thank you for joining, and our AGM will now begin. I'm very pleased to hand over to Carl Cooper, Chair of the Board. Diolch, Carl.
Diolch o galon, Helen, ac bore da I bob un ohonoch chi, a diolch I chi gyd am ymuno â ni heddiw. Yn sicr mae'n fraint ac yn bleser I mi heddiw fel cadeirydd y bwrdd I eich croesawu chi ac I gychwyn y cyfarfod cyffredinol blynyddol hwn. A very good morning to each and every one of you, and thank you for joining us today. It's my pleasure and privilege as chair of the board to welcome you to this annual general meeting. Now, you will have noticed already that our chief executive, Hayley Thomas, isn't with us today, and many will know that Hayley had a recent health diagnosis which has meant that she's needed to take a period of sick leave. And so I just want to assure Hayley in this AGM of our unreserved care and support, and we certainly trust that she will make a very swift and a very full recovery. Our Remuneration and Terms of Service Committee recently approved the appointment of Pete Hopgood as Acting Chief Executive Officer. Pete is our substantive Deputy CEO and Director of Finance and Estates. Also, the committee approved the appointment of Dr. Kate Wright, our Medical Director, as Acting Deputy Chief Executive Officer, and also the appointment of Hywel Pullin, the Deputy Director of Finance, as the Acting Executive Director of Finance. And so I want to say thank you. I'm very grateful to Pete, Kate and Hywel for their readiness to take on these roles and responsibilities during this period of change. I'm equally grateful to the whole executive team and indeed colleagues across the organisation for the smooth and for the seamless way in which this unexpected transition has been managed. I do think that it speaks impressively to the high quality of team effectiveness that has been nurtured over recent years under Hayley's executive leadership. And certainly as a board, we commit ourselves to fulfilling our duties of care to Hayley and to the organisation over the coming months. Felly, rwan, mae'n bleser gen i gyflwyno ein hadroddiad blynyddol ar gyfer 2025 a i 2026. Mae'r adroddiad hwn yn adlewyrchu blwyddyn yn sicr o her, ond hefyd o gyflawniad, ac yn rhoi am wn i cyfrif gonest o sut dyn ni wedi gweithio i wasanaethu ein poblogaeth ni, sef pobl Powys. I'm very pleased to introduce to you today our 25-26 annual report. This report reflects a year of, yes, challenge, but also achievement. And I believe it provides a very honest account of how we have worked to serve our population, the people of Powys. The past year, as we all know, has been one of significant pressure for health and care services across Wales, but actually also across the wider United Kingdom. We are not immune to that in Powys. In fact, we continue to face the realities of an ageing population, an increase in demand for our services, workforce challenges, and the need to operate with a highly constrained within a highly constrained financial environment. But despite these pressures, our commitment to providing safe, effective, compassionate care has remained steadfast. And I'm incredibly proud of what staff colleagues, volunteers and partners have achieved throughout 25-26 and indeed continue to achieve. Across 25-26, we saw progress in key areas, including public health, primary community care, mental health, and we reduced waiting times for planned care. And these achievements are eloquent testimony to the dedication, the professionalism, and the resilience of colleagues across Powys Teaching Health Board and within our partner organisations. At the same time, we're very realistic about the challenges that we still face. Financial sustainability, access to some of our services, workforce recruitment, and the urgent need to transform the way in which we deliver care, and we continue to give that our undivided and our full attention. You will probably have heard of Better Together. This is our service transformation programme. And through Better Together, we are working with communities, with staff colleagues, with partners to develop sustainable models of safe, high quality, timely care that will meet the needs of today's generation and future generations. And so this report that we present today also highlights the work undertaken to strengthen governance, to manage risk, and to put in place robust assurance arrangements, helping to ensure that we as a board continue to fulfil our responsibilities effectively, and also that we continue to be accountable for the decisions that we make and the way in which we use the resources entrusted to us. Ac felly, ar ran y bwrdd, mi hoffwn ni yn sicr y bore yma ddiolch i'n staff ni, i'n gwirfoddolwyr, i'n partneried, yn ogystal â'n cleifion a chymunedau Powys, am eich cefnogaeth, am eich ymrwymiad, ac am eich ymgysylltiad drwy gydol y flwyddyn. Hefo'n gilydd, dyn ni wedi gwynebu heriau sylweddol, a chyda'n gilydd byddwn nhw'n parhau i lunio dyfodol iachach i bobl Powys. So on behalf of the board, I want to thank unreservedly and from the bottom of my heart our staff colleagues, our volunteers, our partners, our patients and communities for your support, your commitment, and your engagement throughout the year. Together, we have faced significant challenges, and together we will continue to shape a healthier future for the people of Powys. And so on our agenda today, as you'll see on the screen in a second or two, I'm going to hand over to our Acting Chief Executive, Pete Hopgood, in a moment, who will present to us a summary of the executive performance during the year. Pete will then hand over to our Acting Director of Finance, Howell Pullin, who will present to us the financial report, and our AGM will conclude with dealing with the questions that you pose to us during this meeting. And finally from me, also on the screen in a moment or two, you will see the details of the members, my colleagues on the board. During 25-26, we did see some changes to our board membership. Our vice chair, Kirsty Williams, left, and she was appointed to take up a role as chair of Cardiff and Vale University Health Board. And I was certainly delighted to welcome Rhiannon Beaumont-Wood, who's been with us as vice chair now for some months, and whose contribution we are greatly valuing and appreciating. Also, Claire Roche left us in October 2025. Claire was our Executive Director for Nursing, Midwifery, Women and Children's Services. And again, we were really pleased to welcome Paul Hooton as her successor. And yet again, we are greatly appreciating Paul's partnership, contribution and colleagueship within the board and within the organisation. So just those changes to note to our board membership. And so without any further ado, I will invite Pete now to present to us the Executive Performance Report. Thank you, Pete.
Thank you, Carl. I'm delighted to provide an overview of the organisation's performance for the year 25-26. The full annual report and accounts is available on our website, which includes the full performance report within it. For today, I've picked out a few highlights just to share with you. So the first slide, this is a brief reminder of our collective health and care strategy for Powys. This was launched in 2017 and remains relevant today and guides our health-related work, not only for the Health Board, but also for our partners in local government and the third sector. And this strategy has been extended to 2029. The next slide summarises our Health Board plan for 25-26, the priorities that guided our recovery, sustainability and transformation journey. It set out our plan of how to improve wellbeing and prevention, to strengthen community-based care, to tackle major health conditions, and develop more sustainable and joined-up services as per our long-term strategy. This is underpinned throughout by our commitment to quality. The plan brings together our key drivers, strategic priorities, and enabling programmes to deliver better outcomes for the people of Powys, and to support our ambition of a healthier, more resilient health and care system. In summary, our delivery against the annual plan for the year was as follows. Of the 327 actions within the plan, 271 were complete, 25 are at risk, and 31 were behind schedule. So that's 83% of actions delivered as set out in our plan. And I would like to say a huge thank you to all of our staff, our board and our partners for their support in delivering our plan. I would now like to highlight some specific areas of achievement. So the first one being faster access to assessment and treatment. One of our most important achievements this year has been helping people to access care more quickly when they need it within our own provided services here in Powys. During 25-26, Powys achieved all national mental health measures, mental health measures, Part 1 standards for both children and adults, ensuring timely assessments and treatment. We also maintained our performance in a number of therapy services, with no long waits reported in key areas and 0 patients waiting more than 104 weeks for treatment in services directly provided by the Health Board. During the year, we maintained our commissioning policy in English providers and continued to work hard with those providers to ensure as fewer people as possible wait more than 104 weeks. We recognise there is still more work to do in this area. The next area to focus on and to highlight is more care delivered closer to home. We know that travelling long distances for healthcare can be difficult for many Powys residents, particularly in a large rural county. Over the last year, we have continued to develop services that bring care closer to where people live. We have progressed new community-based models of care, introduced improved access pathways through single point of access arrangements, expanded community optometry services, strengthened community cardiology and diabetes care, and improved access to musculoskeletal and orthopaedic triage. These developments are helping more people to receive the right care in the right place, reducing unnecessary travel and supporting people to remain independent within their own communities. This is a crucial part of our long-term vision for a healthier and more sustainable health and care system in Powys. The next area is improving health through prevention and early intervention. The best healthcare is preventing illness before it happens, and we have made progress in this area. This year saw strong performance across a range of prevention programmes. Powys exceeded national expectations for smoking cessation, delivered excellent newborn hearing and blood spot screening outcomes, maintained strong childhood immunisation uptake, and launched a new Women's Health Hub to support easier access to trusted health information. We also approved our new Population Health Strategic Framework, helping focus action on preventing ill health and reducing inequalities across our communities. For patients, these achievements mean earlier identification of problems, healthier lifestyles, better outcomes, and improved opportunities to live longer and healthier lives. Prevention remains one of the most important investments that we can make for future generations. Moving on to strengthening mental health services. Supporting mental health and well-being remains one of our high priorities. During 25-26, Powys delivered good performance against national mental health access standards for both adults and young people. We achieved national recognition for our innovative single point of access model, invested in additional psychology therapies, strengthened dementia services across the county, and improved digital systems to support better care coordination and continuity of care. These improvements mean that more people are receiving help sooner, experience better coordinated services, and benefiting from improved access to specialist support when they need it. Mental health is just as important as physical health, and we remain committed to continuing this progress. Improving the overall patient experience. The overall experience people have when they access our services is very important to us. Throughout the year, our minor injury units consistently perform well, with very short waiting times and excellent access standards. We have strengthened support through our Waiting Well service, helping people remain healthy while awaiting treatment. We have improved patient flow through hospitals, enhanced discharge planning, and collected more patient feedback to help us shape future services. These improvements make a real difference to people's experience of healthcare. They help ensure patients can access services more easily, move through the system more smoothly, and feel that their voice is heard in shaping future care. Taken together, these achievements demonstrate our continued commitment to delivering better access, better outcomes, and better experiences for the people of Powys. Despite significant financial and operational challenges, as you've heard Carl outline at the beginning of the AGM, our focus remains firmly on providing safe, effective, and person-centred care, closer to home for the communities that we serve. Moving on to this next slide, this provides a high-level overview of our performance against the National Quadruple Aim Framework. Of the 45 measures reported, 26 are on target or have actions progressing as planned, while 19 require further improvement. Our strongest performance is within Quadruple Aim 2, where 17 of 24 measures are on track, reflecting progress in access, quality, and digitally enabled services. However, we continue to face challenges across all 4 aims, particularly in prevention, system sustainability, and these are being actively addressed through focused improvement plans and ongoing performance oversight. One of the most significant challenges the Health Board over the past year has been our continued escalation status at level 4, targeted intervention, and this is for finance, strategy and planning. This status was introduced by Welsh Government in November 2024 and reflects the scale of the financial and planning challenges that we must address. The Health Board remains in level 1 routine monitoring across all other escalation domains. Whilst escalation is a matter we take extremely seriously, it has also provided a clear focus. Over the last year, we have strengthened governance arrangements, established a dedicated oversight through our board and committees, and implemented a Chief Exec chaired Financial Recovery Board, and enhanced reporting and assurance processes. We have continued to work very closely with Welsh Government, NHS Performance and Improvement colleagues, and our partners to demonstrate progress against agreed de-escalation criteria. Our priorities remain clear. We must improve our financial position, deliver a credible clinical services plan, and implement a long-term transformation programme to ensure services remain safe, accessible, and sustainable for the people of Powys. This includes progressing our annual plan, strengthening integrated planning, and continuing the work of our Better Together transformation programme. Although challenges remain, we have seen encouraging progress. Welsh Government and NHS Performance and Improvement colleagues have recognised the commitment, leadership and determination being shown across the organisation. We remain focused on delivering the changes required to secure de-escalation. I would like to thank our staff, huge thanks to our staff, our partners, board members, local communities for their continued support. Together, we are working to build a stronger, more sustainable health board that can meet the needs of Powys now and into the future. Quality, our duty of quality. Quality is embedded as a golden thread throughout planning, performance management and assurance, supported through the integrated quality and performance framework. During 25-26, implementation of the NHS Wales People Experience Frameworks commenced, strengthening how people's feedback and experience intelligence are systematically captured and used to improve services. This data is analysed and used alongside safety, performance and outcome data to inform improvement and provide assurance to the board. In preparation for the introduction of the Listening to People framework in September 2026, work has been undertaken to further strengthen compassionate engagement, improve early resolution and organisational learning, and ensure governance systems are aligned with national changes to concerns handling and feedback processes. Now, looking forward to our 26-27, the plan on the page, as you can see before you, sets out how we will improve the health and well-being of the people of Powys through 4 priorities: strengthening prevention and well-being, delivering responsive community-based care, improving outcomes for the big 4 conditions, and building a sustainable and resilient health and care system. This is underpinned by quality and our well-being objectives. We will achieve this through workforce development, digital innovation, modern environments, and stronger partnerships, ensuring that we continue to do what matters, deliver equitable access, and provide person-centred care closer to home. Our Better Together programme. Our Better Together programme is our transformational programme which started in 2024. We've been talking and listening ever since. We set out our challenges in the case for change and asked for feedback on this during our stage 1 engagement. We then asked for feedback on scenarios during stage 2 engagement to help us focus on adult, physical and mental health and community services. We have heard clearly from the people of Powys and our partners that any change needs to be purposeful, evidence-based and grounded in what matters locally. People told us that they want stronger primary and community care, an integrated approach, prevention and early intervention, compassionate end-of-life care delivered by skilled staff, and strong partnership between health, social care and the third sector. Feedback from our engagement also recognised that some services may need to be organised differently, including through centres of excellence or regional rural centres, and that some specialist service may need to be delivered outside of Powys where that achieves the best outcomes for our population. But they were also clear that services must remain equitable, and rurality, transport, digital inclusion and access must all be considered in the plans. We recognise there is a strong civic pride in local services, including the contribution of communities, volunteers and unpaid carers. People also raise concerns about equity of access, travel to district general hospitals, cross-border care, communication and information following the patient. Also, loneliness and isolation. Therefore, the emerging model has to do two things at once. Protect what people value about local care while creating a more integrated, preventative and sustainable model that goes into the future to meet the needs of our population. We recognise that any change can be difficult and cause concern. We have been undertaking the technical work since summer 2025 and have held a number of events with service users, general practitioners and other clinicians to help develop our work. This work is required to ensure options are robust, viable and appropriate for Powys. We're now finalising these options to be ready for the board to determine if we are ready to undertake a public consultation in the autumn of 2026. This decision will be taken in September 2026. Further details and other information in relation to our Better Together programme are all available on our website. And finally from me, this slide highlights that health and wellbeing in Powys is delivered through a whole system partnership approach. While the Health Board plays a central role, outcomes depend equally on individuals, families, carers, communities, voluntary organisations, local authorities, primary care, social care, ambulance services and our hospital partners across Wales and England. By working together across these networks, we can provide more joined up, person-centred care, support people to stay healthy and independent for longer, and ensure the best possible outcomes for the people of Powys. I would like to thank all of our partners locally here in Powys, regionally and nationally for their continued efforts in delivering healthcare services for the people of Powys. I would now like to hand over to Howell, who will present our financial slides and performance. Thank you, Howell.
Howell, I'm sorry to interrupt you. I can't hear you. I'm not sure if others can, but just I can see that you're off mute, but...
Thank you. Can you hear me now?
I can, Howell. Thank you. Sorry to interrupt.
Thank you, Pete. And Bwrdd, good morning, everyone. Howell Pullen, Acting Executive Director of Finance. The annual accounts are an important moment in the annual year of an organisation as it reflects the stewardship of public monies. And what I'm going to do this morning is just talk through what the three key performance targets that we have as an organisation, explain where we spend our resources,
and also talk through the independent view of the Auditor General for Wales on our annual accounts. So this slide here highlights the three areas where we have key targets. The first is around revenue expenditure. This is expenditure on day-to-day items, such as paying for people to receive operations in neighbouring hospitals, salaries of staff, food in the canteen and on wards, etc., etc. And we have a target here to make sure that we use the monies that were given from the government and not overspend against that. As you'll be aware, we had planned to overspend, and that is indeed what happened, with a £33.3 million overspend against those resources. So we didn't meet that target. Capital expenditure is expenditure that's being used to purchase items that will be used by the Health Board over 1 or more years. And a classic example would be expenditure on hospitals and on buildings, equipment and IT systems. We have managed our expenditure within the limit from government with a small underspend of £74,000, and therefore we've met that key target. But the final target that is focused upon is our ability to promptly pay non-NHS suppliers of services to us, with a target of paying 95% of these people within 30 days. That is also something that we were not able to achieve during last year, with a performance of 92%, just slightly below the 95% target. On the next slide then, we provide information about how we are using our resources and whether we are managing to stay within the statutory duty not to exceed the funding that we receive. And you can see on this slide that our overspend has been gradually increasing over the past 3 years. 12 million, 16 million in 24-25, and now 33 million in 25-26. Giving a cumulative overspend against that target of £61 million. The next slide focuses on capital, and you can see that in this area we've been able to manage our resources within the funding that we have received, with a small underspend each year against the resources given to us, so that we continue to achieve and comply with this statutory target. And then finally, in terms of the targets, you can see that for the public sector prompt payment on the next slide, that we have a target of 95%, and we achieved 91.8% in terms of the number of invoices that were paid within 30 days. Turning to the next slide then, this explains how we use the resources that we are provided by the government. And you can see in this slide that £85 million worth has been spent on primary healthcare services, £267 million expenditure on healthcare from other providers, and £172 million expenditure on hospital and community health services, monies that we are spending for the services that we ourselves provide. We've also received £19 million worth of income from a variety of sources to help support this expenditure. And on the next 3 slides, I will just expand upon each of those areas so that you can get a feel for how we are spending our money. So firstly, starting with primary healthcare, in the pie chart, that the blue area reflects the monies that are spent with our partners in primary care within GP practices in particular. They play a crucial role in the provision of healthcare services to the population of Powys. And you can see that we spend £46 million with them to support the services that they provide. There are smaller amounts then spent with dentists, community pharmacists and opticians, and the large sort of green quadrant reflects the amount of monies that are spent on prescribing and drugs for people. The next slide focuses in on healthcare provided by other providers. These are key partners for us surrounding the boundary of Powys, stretching from Robert Jones Agnes Hunt in the northeast, just outside of Oswestry, to Shrewsbury, to Hereford, to services provided from the Grange Hospital, Prince Charles Hospital in Merthyr, Swansea, all the way around to Aberystwyth. And you can see here with the orange part of the pie that we're spending the largest chunk of our money in this area with those providers in England, and that there has been an increase in the amount that we have spent there, particularly with Hereford between 25-26 and 24-25. There's also an important area of expenditure which is reflected in green on continuing healthcare and funded nursing care. And another area which I would like to pull out, which is around the use of private providers for providing care for patients with complex mental health needs. Now, each of these three areas that I've just highlighted here are areas that we are seeing an increase in our costs year on year, and they are contributing to the increasing expenditure and the growing overspend that we have experienced in recent years. Finally, then, the third area of expenditure, just to highlight and talk through, relates to our hospital and community spend on the next slide. And on this next slide, it shows, oh, sorry, let's go back one, sorry. It shows that the main area of expenditure is, of course, on our staff, who play such an important part in the provision of services to the population within Powys. And then there are other areas such as clinical supplies and services, general non-pay, and some technical accounting items connected with capital assets, such as depreciation and impairment. And finally, in terms of my presentation on the annual accounts, I wanted to highlight the independent view that's provided to us by the Auditor General for Wales. And there are two key aspects to that. The first is about the regularity of our expenditure. And this is a view provided by the Auditor General for Wales on whether we are spending monies as authorised and intended. And because we have overspent against our revenue resource limits, then the opinion is that our expenditure has been irregular in 25-26 due to that overspend because of the statutory target to ensure that our expenditure is within the revenue resource limit. And this has been the situation for the last 3 or 4 years since we have experienced an overspend. On my final slide then is the other aspect of the Auditor General for Wales opinion, and this is the area that those of you that have your own accounts, such as say for a farm business or for a company, where it would be used to the external auditors talking about the true and fair opinion on the figures in our annual accounts. And again, in this area, the Auditor General was able to issue an unqualified audit report, as has been the case for a number of years. That concludes my presentation on the annual accounts, but of course, happy to take any questions on it. In the meantime, Carl, hand back to you. Thank you.
Oh, Howell, thank you ever so much for sharing that with us, and thank you to Pete as well for the Chief Executive's overview. So now's the time in the meeting where we turn to any questions that we've had. Some we've received in advance, and please remember, for anybody watching the event, there is a live question and answer tab, so please do feel free to submit anything that you would like to into that tab as well. In the meantime, though, I'll go to some of the questions that we've received earlier. And I'm going to invite some executive colleagues to come and join us, if that's okay, to provide the responses to some of these. So Elaine, I'm going to come to you first, if that's okay. And the first question is, how are you ensuring Powys residents can access NHS dentistry and GP services? Thank you.
Bwrdd, good morning. My name is Elaine Lawton and I'm the Executive Director of Primary Care, Community and Mental Health Services for the Health Board. So in terms of general practices and general dental practices within Powys, these are independent contractors who provide NHS services to local communities and are really important for local populations. We work closely with these providers to ensure that what they're providing is safe, effective, sustainable, and we remain in regular contact with providers to provide that assurance. We operate a contract assurance framework in which we check the quality, the safety and the services that are delivered, including patient experience, workforce sustainability and delivery against national standards. And I think it's really key that we recognise the voices that we receive from our population, often shared with us through CLICE, that access to these services is absolutely key. At the end of 25-26 for general dental services, we received a number of notices against the contracts that we provide there, and we have been taking time this year in order to procure and put new contracts in place, and that work is continuing. We have also invested within our community dental service, which is a health board provided dental service, to allow us to bridge some of the gaps that we have had within dental care for our population, particularly in terms of urgent access, but also in terms of some general dental access as well. We also compare our activity and our performance across Wales, and what we know is that our Powys population receive about 70,000 or over 70,000 appointments each month within general medical services, and per head of our population we have the highest level of performance. There is a difference, obviously, between whether everybody always receives exactly what they want, and that feedback, again, that we receive through CLICE and into our concerns teams helps us inform whether each of those 16 general medical service providers are delivering what we need them to for our population. And we manage that, as mentioned previously, through our contract assurance framework, the visits that we undertake with practices, and the checking of data and feedback that we receive. Thank you.
Elaine, thank you. Thanks very much for that answer. Much appreciated. I'm going to go next to Deb Wood-Lawson then, if I may. And Deb, we heard a lot in the board's meeting yesterday that's also available to members of the public about Better Together, our transformation programme, and Pete, of course, has mentioned that earlier on in his presentation as well. But the question, Deb, is what decisions have been made so far under the Better Together programme, and will any community hospitals close as a result? Thank you.
Good morning, Deborah Wood-Lawson, Executive Director, People, Culture and Transformation. This is a timely question given a board assurance paper on Better Together was presented yesterday alongside the approval of the consultation plan. These both documents are related to phase 1 of Better Together, which is adult, physical and mental health community services. Both these documents, alongside other important information on Better Together, can be found on our website. We know demand for our services is increasing, our population is ageing, our workforce gaps are real, and our buildings are very old, alongside significant financial challenges. Therefore, we know that doing nothing is not an option. We are progressing with the development of a pre-consultation business case, which will be taken to board mid-September, seeking a decision to move to formal public consultation thereafter. No decisions will be made on the future of sites and their services until after that consultation period is concluded, and we have heard from our communities, our patients, stakeholders and staff. It is anticipated that the board will be asked to consider a post-consultation decision case sometime in the spring of 27.
Thank you, Deb. Thanks very much. And as we know, there's quite a lot of public interest in Better Together, so really helpful to have that clarity. And as we said earlier on, there is significant amounts of information on our website that members of the public, our partners and other colleagues are able to access. So Deb, thank you very much for that. Much appreciated. Changing agenda slightly then, Paul, going to come to you if that's okay. Thanks, Paul. And the question is in relation to incidents. So what lessons have been learned from serious incidents and complaints over recent periods?
Hi, good morning all, and thank you, Helen, for the question. So I would start by saying, as an organisation, we have a number of processes and mechanisms in place. First, to become aware of concerns and incidents. We have what we used to have was putting things right, where our public can raise concerns in relation to the care that they receive. That's recently been replaced by listening to people, which is the new national All Wales listening to people framework for our public to raise concerns and equally pay compliments. We also have our duty of conduct process. That is where incidents occur within the organisation, and we have a duty of conduct to let our patients know or the people involved know what that concern was and how we're addressing it. And we also have our DATIC system, which is our internal system that where our staff and members of the public equally can raise concerns and record incidents that we would investigate. Using all of that intelligence then, the learning that comes out the tail end of all our investigations is then embedded back into practice. I would say to the question you've asked, what is our key learning for the past year? I think our number one is around communication. It is a key theme that has come through all our incidents and concerns raised, particularly communicating better with patients and with families. One of the strongest recurring themes was about importance of timely, clear and compassionate communication with patients and families and carers. And what we've done in this space is we've put greater emphasis on involving our patients and our carers in decision making about their care and improving engagement following concerns and adverse events. And we've done considerable training with our staff to ensure they understand the importance of communication, and equally are putting other mechanisms in place around patient information and patient leaflets in all our inpatient and clinics. Another theme that has come through was around stronger clinical documentation. We consistently audit and review documentation, and where incidents occur, we always review our documentation. Again, these reviews have highlighted the need for accurate, complete and continuous clinical records. Again, as a result of this, the audits, we have increased training and strengthened and reinforced training and revised processes around documentation. And we've also increased our auditing of documentation to ensure that our new standards have been met. A third area that I would want to highlight is around improved risk assessment and escalation. Again, learning identified opportunities to improve assessment, escalate and risk manage. This has informed updates to clinical processes and reinforced the importance of early recognition and escalation of deteriorating situations. And again, significant training has been delivered across the year to all our staff in relation to the importance of risk assessment and escalation. I think finally I would pull out how learning has been translated into action. So we've seen improved standard operating procedures across our organisation as the outcome of a lot of our audits. We've strengthened induction and training for staff. We've improved incident review processes, And we've also better patient and family engagement following incidents now, and ensuring that they're kept up to date and well informed as the investigations progress and their outcomes. That's it for me, Helen. Thank you.
Paul, thank you ever so much. And you know, as we know, so important to be very open and honest about those points of learning and what it is that we've done about it. So thank you, Paul. Thanks very much for your time in responding. Next question then, Elaine, we're coming back to you, if that's okay. And the question is in a partnership question in relation to Powys County Council. So how are we working with Powys County Council to provide more joined up care? Thank you.
Thank you, Helen. And this is a really important question. So we know within the NHS that the health and well-being of our population is dependent on far more than just the health service. So how we work with partners, particularly the local authority, but other partners such as Powys Association of Voluntary Organisations and the wider third sector, our primary care providers and other partners within our communities and in the neighbouring areas outside of Powys is really critically important. And that partnership operates at a few different levels. So in order for us to coordinate and provide effective care, we've got a strategic level. So we work with a range of partners and we have the Regional Partnership Board for Powys and also the Public Service Board that supports us to deliver on a partnership basis, to plan on a partnership basis and to understand the health needs and the health and well-being needs of our population. At an operational level, and that's closer to where it really matters for people and people will see and feel the impact of that, our teams come together. So we have health board colleagues, a range of community staff, depending on the need of the individual, our local authority colleagues, particularly around adult social care, Parvo, our GP practices and other providers, and they work together on a day-to-day basis, and they also come together in the clusters. We have now 2 clusters in Powys, but last year we had 3 clusters, the North, the Mid and the South, and they help to identify the gaps that we believe there are in how we can work together and to deliver more effectively in a coordinated way. So we recognise that we have to be responsive both in that strategic space to enable us to plan and utilise our resources most effectively, but we really need to make sure that the teams in the areas on the front line can work together to solve the challenges that our population have, particularly those people with most complex need, who need a number of different professionals working together to help them live independently in the community. And our ambition is that by strengthening that and growing that over the next few years, we will reduce the impact on poor health that people experience. We will enable us to provide more of that care for people in their own homes and in their communities.
Elaine, thank you. Thank you for explaining what I know is a very complex and multifaceted area. So thank you ever so much. I'm just double checking. I don't think we've received any additional questions that have come in from members of the public and partners. So on that note, can I just say a big thank you to executive colleagues for supporting and providing the answers to the questions that we've received. For anybody watching, please do remember we always have a standing item within our in public board meetings. So the board meets on a bi-monthly basis, 6 or so times a year. So there is always the opportunity to ask our board any questions that you want to, and we'll always make sure that we respond to those. But for today, Carl, I'm going to hand back to you for any closing remarks, if I may. Thank you.
Thank you, Helen. Diolch yn fawr i chi. So that brings this annual general meeting to a close, and it simply remains for me to reiterate some of the thanks and appreciation that has already been voiced by multiple colleagues during this meeting. And I first want to say a big thank you to my board colleagues and both independent members and executive members. Within our board, we are very, very fortunate to have people with a wide breadth and a richness of skills, of experience, expertise and knowledge, and individually and collectively that's brought to bear on fulfilling our responsibilities as a board as effectively and as efficiently as possible. And so I do want to thank each and every one of my board colleagues for their contribution during the year. I particularly want to thank them for our unrelenting focus on culture. We know that how we do things is as important, perhaps even more important than what we do. And so being a values-driven board, a values-driven organisation where we seek to model the behaviours we want to see across our organisation is something that is central and of central importance to us. And so a big thank you to all for that, for maintaining that focus. And as has already been said several times during this meeting, and if I can beg the forgiveness of John Donne, no health board is an island, and therefore we are reliant on the people and organisations alongside whom and with whom we work. And so once again, a very, very big thank you to our staff, to our volunteers, to partners, to the people and communities of Powys, without whose cooperation we would not be able to achieve the things that we are achieving and face the challenges that we do face. And so finally, a big thank you, diolch o galon I bob un ohonych chi am eich cyfraniad, am eich cydweithrediad, a diolch hefyd am ymuno â ni yn y cyfarfod cyffredinol blynyddol hwn heddiw. Diolch.